So you're 81.
No, not February 3rd.
February
Another
3rd.
week.
Another week you'll be 81. You can just continue cruising, enjoy your life, all the good stuff, but you decided to go back into the game.
Yes.
Why is that?
That's a good question. I had the properties. I had the implant factory, and I kept it empty. I wouldn't sell it or lease it out. I had in Valencia a 20,000 square foot building where we had over 100 people in customer service. That building was mine and empty. And I have in Vegas the shipping and the clean room as part of a building complex that I have. So I had all the infrastructure. I had the people. I had the knowledge. And I knew I could make improvements. I knew what was needed to simplify the products. Until I got into the design, ideas didn't come to me exactly how I was going to do this. I'm very excited about the innovations that I'm coming up with, and I'm happy to share them with you.
We'll love to hear them. Before we get into it, where does the name Nizplant come from?
Nizplant. Well, I've never named an implant after me, but this implant is so innovative.
Right.
And it goes back to the very first thing that got me into implants, overdenture. So this is an implant that has a dual function platform. You can use it for an overdenture. It'll take a locator attachment, or one with a will make, and it also can take a screw retained.
Right.
So the idea is that you could put in 4 of these implants and convert their denture to an overdenture as a good transition. It takes a lot less effort to convert a denture to an overdenture than to start drilling holes and try and make it a fixed case, a lot less chair time. And then if the patient wanted a fixed case down the road, you could come back and the implant will accept the screw-retained multi-unit abutment.
See. So it's a combo.
Well,
you know what? I'm not going to spoil it. Let's get into it.
Okay.
Very exciting.
So on the left is one of my first ads. My first ad on Corvent, showing its different attachments for overdentures, for multi-unit, some cases that I did. There's 2 freestanding. So this goes back to 82. And from there, I go to the new system, which I call GEN5. So Generation 1 was the core vent. Generation 2 in 86 was the screw vent. Generation 3 was the tapered screw vent in 1999. And Generation 4 was the legacy with Implant Direct, and I call the new implant Generation 5. It's a tapered screw, the same material, the same surface as all these other implants were, with a little different platform that it gives you 2.5 millimeters of smooth neck, and I'll explain why that is. Now, what made Implant Direct successful was its online ordering, really simplified things, and the customer service of having 100 telemarketers in one facility that we could train and educate. And I'm going to try and duplicate that with the new company. As a matter of fact, we've already started to build the customer service and gather the email addresses. So in 2011, an independent firm did a survey, and we had the highest customer satisfaction in the U.S. Astra was second, Straumann was third, Nobel and Zimmer were fourth, and then some other ones. So we could deliver with a customer service and a high-quality product. That's what made Implant Direct successful. This is an image of the new products. Now, there's really the same body on 3 implants. The first one is the GEN5, and here I show you the price we're going to hit the market at, $100. GEN5 Plus is the same implant with a friction fit healing collar attached that serves as the transmucosal part of a multi-unit abutment or the base of a variety of other abutments. So we've got the GEN5, the GEN5 Plus. Here it's showing with its fixation screw. And then the Nizplant, which is a one-piece implant, and the top is the size of a locator attachment. On the outside, it would take a locator attachment. On the inside, it takes a snap-in ball. So this also has internal threads. An internal set screw comes closing those threads off. If you're using it for an overdenture, you can take out the set screw and add a variety of abutments or just a titanium sleeve for a multi-unit. Here's one of the patents that I filed. A 2.5 millimeter smooth neck with score lines at 1, 2, and 2.5. The idea is hybrid designs are gaining in popularity because people recognizing peri-implantitis is a big concern. So if we have an implant that has a smooth neck, it's easier for the patients to clean. Studies have shown that the Straumann with its smooth neck has about 1/3 the peri-implantitis incident of companies like Astra and Nobel, who at the time had their rough surface all the way to the top. Now the Nobel has a smooth neck as well. But what I did is I added 1 millimeter to the length of every implant. A 13 is really 14. Now we call it 14. And we have score lines. And the trick is to get the implant abutment junction just above the bone so that you don't need to recontour the crest in order to get a flared abutment in. And you've got the junction supracrestal, so if there's any micro leakage or any bacteria in that niche, it's out of the bone and in the soft tissue. Then you want to have some smooth below the crest, because when you bone remodels and you lose some bone, you want a smooth surface exposed. Fact of the matter is that most of the time when you're placing an implant, the ridges are uneven. If you put it level with the lingual, it'd be 2 millimeters exposed on the labial. Or if you're doing an extraction socket, you got to do a lot of bone grafting to cover up the exposed surface. This should eliminate a lot of that. So that's one of the big changes, is a longer smooth neck with score lines. So here again is the GEN5. The GEN5 Plus with this collar is friction fitted. We'll talk about that. And by adding this prosthetic screw, you turn it into a standard multi-unit abutment. And the Nizplant has a dual function platform. So here's the patent that I filed on the extender, friction fit extender, that will get that junction up higher. The big thing is vertical flexibility when you're placing an implant. The ridge can be sloped, bone can recede. You got tissue thicknesses different if you want it to be one stage. So you can't just rely on a fixed smooth length neck. You need the ability to move that implant up and down. And here is the GEN5 Plus. So this shows the friction fit collars that are added at the factory. These are the screws that would convert it to a multi-unit abutment. We have a variety of abutments that'll sit on that platform. So this will get that platform up closer to the level of the tissue where it's easier to restore. This is like Nobel's on-one system, except there you have to buy the healing collar and screw it in, and then you screw in your prosthesis or your crowns into the top of that screw. This healing collar is attached friction fit. An important thing is the emergence profile. Companies that have one connection only end up with a very poor emergence profile on the wider implants. So we've got two different connections. They're color-coded, yellow or pink. And because of that friction fit occurring, we can even overlap the shoulder, as you see here on the wider one, and have a perfect emergence profile on a wide implant. This is showing all the variations in height. A big problem is how many abutments are you going to inventory? You need 2, 3, 4, 5 millimeter abutments. You don't know what the tissue thickness will be. Well, with this implant, you can move this from 2 to 4.5 above the bone. Just from the positioning relative to the score lines. And then these fixation screws that you attach, the prosthetic screws, come in several heights as well. So all you need to inventory are the fixation screws, 4 of them for $100, your entire inventory is a couple of sizes of these fixation screws, prosthetic fixation screws, perfect for totally dentureless applications. This is for totally dentureless, but also with all the different abutments that we attach. When you're uncertain of the tissue thickness, this is a great implant. It gets the connection up. If you ever want to drop the margin of the crown down, you could take that off and go right down to the implant. Here's a case of immediate insertion of a number of implants, and this is typical. You see exposed threads and rough surface that are going to require bone grafting, whereas with the Gen5 Plus, the extender is already pre-attached and the neck is smooth, so it doesn't matter if it gets exposed. And then you attach these prosthetic screws and you convert it into a multi-unit case. Whereas here, you can see they're trying to attach the abutments in a pool of blood. You trap blood in the connection. So this is a much cleaner, simpler solution. Then the Nizplant we've talked about, it's a one-piece implant, so we can make it 3 millimeters in diameter, all the way up to 5.7. And the platform is the same. It's a lead-in bevel internal hex, so it'll function as a multi-unit abutment or for anything else you want, or an overdenture. The idea being that you can deliver 4 of these with an overdenture and later convert it to a full arch fixed restoration. And filed a patent on that as well. Here's a simulated case showing 4 of them in the maxilla. The packaging is very simple. This implant hasn't had its surface put on it yet, but this is the kind of vial that we have, and all the components for the overdenture are included at that $150 price and come in the package. We're also going to simplify the surgical procedures. Here's our surgical tray. We'll have drill stops, color-coded drill stops, that you can decide, do I want to place the implant a millimeter above the bone, or do I want to place it level with the bone? You pick the drill stop you want, and the diameter, outside diameter of the drill stops works with a surgical guide. So the problem with surgical guides, you have to use a key for every different drill, or you have to, some people are now launching drill kits where they're length specific and have the hub on it. You don't need to do that with this, and you don't need to guess where the stop is based on how high you position the surgical tray, because you just put this down and it'll stop on the bone when you want. So I think that's going to be a real neat addition. All right, here's a picture of my aerospace companies. This is a fuel floor. This is the thrust reverser, and here's the award we received. And we didn't receive it for being Spirit Aerospace's biggest supplier, just the one with the best precision and the best on-time delivery. Here's a picture of the hotel. The convention center, and I'll be doing lectures in this on the East Coast, 2 18-foot screens in the ballroom. And finally, this is a nice image of the 3 implants, Gen5, Gen5 Plus, and Nizplant. And we think this is going to really be a benefit to the profession when I bring this to the marketplace. We're going to do it internet only. There'll be no salespeople. How do you make an implant and sell it at $100 when you're investing $25 million or more before you sell your first implant? And you do it by keeping your product line narrow and innovative. And have good customer service from inside salespeople, and a simple shopping cart. Remember, there's only 3 implants to choose from. There's not 16. So it's really simple, and pick the right implant for the right application. And that's what Paragon is going to be all about. Simply smarter.